Future nurses, welcome back! The GI system has some tricky vocabulary words like intussusception, volvulus, and tenesmus.
Ever open a Med-Surg chapter, see all the bolded terms and feel lost before reading the first line? Key terms are just a small part of the work, but they unlock the rest. If you learn term first, the rest becomes easier to absorb. Today we are diving into Chapter 58, Coordinating Care for Patients with Intestinal Disorders from the Davis Advantage series. Now, before we delve into the more serious topics such as diseases and surgeries, in this next video we need to establish a common language. The GI system has some tricky vocabulary words like Intussusception, Volvulus, and Tenesmus. If you see those on NCLEX or in clinicals, you don't want to be scratching your head. So in this video, I'm breaking down the essential key terms you need to know, we need to know, categorized so they really actually stick. Grab your coffee, open your notes, and let's master those terms. First, let's talk about the signs and symptoms, what you will see in your patient or what they will complain about. First key term is dyspepsia. This is the medical term for indigestion. Think upper abdominal discomfort, bloating, or burning. So indigestion or discomfort in the upper abdomen, often associated with bloating, nausea, or burning sensation. The next one is eructation, a polite way of saying belching or expelling gas from the stomach through the mouth. Then we have tenesmus, distressing spasms of the anal sphincter. The patient feels a persistent, urgent need to empty their bowels, even if they are empty. So tenesmus spasms of the anal sphincter with a persistent urge to defecate, commonly seen in ulcerative colitis. Narcotic bowel syndrome. This is a chronic abdominal pain that actually worsens with long-term opioid use. It becomes a vicious cycle. So chronic abdominal pain and altered bowel habits related to long-term opioid use, often worsening with continued narcotic use. So think about narcotic bowel syndrome, it's the chronic abdominal pain. The next one is the ecchymosis, a fancy word for a bruise or subcutaneous bleeding. So large area of subcutaneous bleeding, bruise, often caused by trauma or bleeding disorders. Next, those are your clinical assessment signs related to the key terms. Let's try the first one with McBurney's point, specific to appendicitis. It is the point of extreme tenderness in the right lower quadrant. What else we know about this? It's a location on the right lower abdomen that is tender in cases of appendicitis, situated on third of the way from the anterior superior iliac spine to umbilicus. So think about McBurney's. It's the location of right lower abdomen, and it's tender in cases of appendicitis. Next, it's the Rolf signs also for appendicitis. This is when you press on the left lower quadrant, but the patient feels pain on the right. So pain in the right lower quadrant during palpation of the left lower quadrant, a clinical sign of appendicitis. The next we have the other side, the Cullen's sign. Remember the C for center. This is bruising around the umbilicus, so it's the belly button. It usually indicates intra-abdominal bleeding. So again, bluish discoloration around the umbilicus, often indicating intra-abdominal bleeding, such as from pancreatitis or rupture ectopic pregnancy. So Cullen's, it's the bluish discoloration around the umbilicus. The last one is the gray Turner signs or the Turner signs. Remember the turn, you turn the patient to see their flux, so the side. Bruising here indicates retroperitoneal bleeding. So bruising on the flanks, so side, indicating retroperitoneal bleeding, often associated with severe pancreatitis. Now let's define the actual physical problem happening inside the gut. Let's start with volvulus. Think of a wet towel being wrung out. This is the twisting of the intestine. It cuts off bloody supplies and it is a surgical emergency. So think about twisting of the intestine around itself, leading to bowel obstruction and compromised blood supply. So volvulus, it's the twisting. The next we have intussusception. Think about a telescope. One part of the intestine slides inside another part, causing a blockage, which is a condition in which part of the intestine telescopes into an adjacent section, causing the obstruction. So it's a condition in which part of the intestine telescopes. The next we have stricture, a narrowing of the intestine, usually from scar tissue, like a pipe getting clogged. So this is like narrowing of the intestine or other tubular structure, often due to chronic inflammation or scar tissue. So strictures, it's the narrowing of the intestine. Then we have fistula, an abnormal tunnel connecting two body parts that shouldn't meet, like the bowel and the bladder. So it's an abnormal connection between two body parts, such as the intestine and the bladder or skin. Next, we have fissure, a painful tear or crack in the lining of the anus. So it's a small tear in the mucosal lining of the anus, causing pain and bleeding during the bowel movements. So fissure, it's like a small tear. Abscess, a localized pocket of pus caused by infection. So abscesses are like a localized collection of pus caused by infection, often resulting in swelling, pain, and redness. In intestinal disorders, abscesses may develop in the abdominal cavity or perirectal area. So abscess, it's a localized collection of pus caused by infection. The last one in this category, familial adenomatous polyposis, a genetic condition where hundreds of polyps form. Without treatment, cancer is almost 100% guaranteed. So it's an inherited condition leading to hundreds of colorectal polyps, with near 100% risk of developing developing colorectal cancer if untreated. That's why they call it familial, so it's inherited. Finally, let's talk about the procedure used to fix those problems. Stoma versus ostomy. Ostomy is the surgery creating the opening. Stoma is the actual pink-red opening you see on the skin. So stoma is an opening created surgically to divert waste out of the body, such as in a colostomy or ileostomy. Then ostomy, it's a surgical created opening in the body for the discharge of body waste. Ileostomy, it's the opening from the ileum, small intestine. The drainage is liquid. So it's a surgical creation of an opening from the ileum to the abdominal wall, diverting fecal material into an external appliance. Colonostomy, it's the opening from the colon. Drainage, it's more formed. So colostomy, it's a surgical creation of an opening between the colon and abdominal wall to divert fecal matter into an external bag. Then we have the colectomy versus hemicolectomy. So it's the removal of all colectomy or half hemi of the colon. So colectomy is the surgical removal of all of the colon indicated for cancer, severe inflammatory bowel disease, or trauma. The hemicolectomy is surgical removal of either the right or left portion of the colon. Anastomosis is the surgical reconnection of two bowels and a leak. Here it's a major complication. So it's a surgical connection between two structures, such as segments of intestine, to restore continuity after resection. The abdominoperineal resection, a major surgery removing the anus, rectum, and sigmoid colon, results in a permanent colonostomy. So it's a surgical removal of the anus, rectum, and sigmoid colon, usually performed for rectal cancer or severe inflammatory bowel disease. Then the cockpouch continent ileostomy, it creates an internal reservoir, the pouch, for stool that the patient drains with a catheter, so no external bag is needed. Here we can talk more about the diverticulum, which is the outpouching of the mucosal lining of the intestine through the muscle layer, often seen in the colon. We have the fecalith, a hard mass of stool that can obstruct the appendix or colon, potentially leading to appendicitis. The gluten, we know it's a protein found in wheat, barley, and rye that can trigger an autoimmune reaction in people with celiac disease. Also, we have the hereditary non-polyposis colorectal cancer, or Lynch syndrome. So it's an inherited condition increasing the risk of colorectal cancer and other cancers, often without numerous polyps. Herniorrhaphy, it's a surgical repair of the hernia by returning protruded tissue to its proper place and reinforcing the abdominal wall. So it's a surgical repair of a hernia, herniorrhaphy. So it's surgical repair of hernia. Then we have the metastasis. It's a spread of cancer from the primary site to distinct organs or tissues. The rectocolectomy is a surgical removal of the rectum and all or part of the colon, often performed for ulcerative colitis or colorectal cancer. The Turner signs, it's the other term for great Turner sign, indicating a flat bruising from retroperitoneal hemorrhage. So this is the list of my key terms. The abdominoparental resection, abscess, anastomosis, colectomy, colostomy, coolant signs, diverticulum. Let's scroll down. Then we have dyspepsia, ecchymosis, eruction, familial adenos polyps, fecalith, fissure, fistula, gluten. The gray Turner sign, hemicolectomy, hereditary non-polyposis colorectal cancer or LIMS syndrome, herniorrhapathy, ileostomy, Intussusception. Oh my God, I'm so it's hard for me to pronounce those ones. The cock pouch, make a Burney point. We have the metastasis, the necrotic bowel syndrome, ostomy, poucitis, the proctocolectomy, roving signs, stoma, strictures. Scroll down. Tenesum, Turner signs, Volvulus. So again, thank you for watching to the end. Please like, share, and subscribe, and see you in the next video. Yoo-hoo, that was a lot of vocabulary, but knowing those terms, it's half of the battle. If you can distinguish volvulus from intussusception or colons from Turner sign, you're already ahead of the game. But now that we speak the language, we need to put it into an action. What do we do for a patient with a bowel obstruction? How do we distinguish Crohn's from ulcerative colitis? In the next video, I'm going to give you a detailed chapter summary covering the pathophysiology and nursing care for all those disorders. The chapter is quite long, so it will be different as I used to do before. You wouldn't want to miss it. Click right here to watch for part 2 of this chapter. Thank you for being here with me today, and bye for now.